Topic for today, what we are going to talk about is emergencies. Now, I'm going to deal with emergencies who can come in a maxillofacial or a oral surgical or a dental surgical emergencies. It's mostly we are talking about that type of emergencies which we can encounter and what we need to be prepared to take an emergency, right? So, what's an emergency? Basically, like when you prepare for an emergency, the emergency ceases to exist. That's as per Goldberger E. Now, why do we say that? We need to be prepared to face an emergency. But in an ideal world, it's better to prevent an emergency from happening, right? In fact, if we have to anecdotally say that one of the best answers, like why do we have a brake, right? Now, only if with a brake, you can actually go faster, right? You know how to stop, when to stop. That's the type of one. Now, if you get a patient, the ideal thing, you want the patient to go alive out of your clinic. That's the important thing. The patient might have got so many comorbid conditions. You need to understand that. Or even without a comorbid condition, that the patient might develop an emergency because of anything else. Like it could be drug related, it could be just whatever, the patient could have choked. There are quite a few things which can happen to become an emergency. So how do we prevent an emergency? So you need to be prepared for an emergency, and the moment you are prepared, more often than not, the emergency becomes even planned, right? So how do you plan for it? What do you need to do? That's what we are going to look for in this particular presentation. So then, what are the types of emergency? As I told you, like I'm going to put it more like a dental clinic type of emergencies, but I'm also going to add on the so-called surgical and medical emergencies which can develop while the patient is in either a maxillofacial clinic or a dental clinic. All right. So any clinical situation, if managed inappropriately, may turn into emergency. One of the classical thing which happens, vasovagal syncope, right? Syncope happens so very often. Now, if any of the dentists whom we are talking to, if they say they have never seen a syncope in life, the only thing is probably they have not seen enough patients in life, right? More often than not, we do see a syncope. Patients do go in for a syncope because there are people who are emotionally unstable. They might be really hyperexcitable. There might be other conditions, right? Vasovagal syncope is probably the commonest emergency which you would come across in your practice. And even that vasovagal emergency, vasovagal syncope, which is usually a self-correcting emergency, if it is managed inappropriately, we can end up with a real emergency, right? Foreign body, I'm not talking about anything very different, right? Think about the foreign body, the commonest foreign body, which is not, I wouldn't say commonest, but it happens so very often, is dropping instruments inside a patient's anesthetized throat, right? It happens very often. Now, there are enough and more literatures. Now, people have dropped endodontic files, reamers, most of the instruments which are used for implants. In fact, it is mandatory when you talk about a reamer or a file, they have in their handle, they have a small hole through which you are supposed to have passed a dental floss around it, so that the edge of the floss, the end of the floss is always outside, so you should be able to retrieve it out. So they have not come across with it if they have not gotten that many incidences of happening. Obviously, if you place a nice rubber dam, those things can be eliminated, that risk can be eliminated itself. Nevertheless, even for placing a rubber dam, you're going to use a clamp. And can that clamp just slip and fall back? Yes, it can. So we are having a lot of small instruments, and so foreign body dislodgement into the upper airway or into the gastrointestinal tract. Luckily, most of it is an ingestion. It's not an inhalation. So if it's an ingestion, which when it goes into a gastrointestinal system, it can be managed. It can be managed relatively, sometimes Conservatively, you have to just follow it up. People have swallowed crowns. People have swallowed small bridges, right? As long as there is nothing sharp about it, it will just pass through the gastrointestinal system and eventually get expelled in a day or two, right? We need to just make sure that it is gone, radiographically and otherwise. But if it's a sharp instrument, you might have to go in for a, like what you say, endoscopic retrieval of that instrument. Versus still, if it has gone into the airway, yes, it can even cause choking, which means it can cause an obstruction of the airway, or versus still, if it goes and lodges inside the lung, inside the bronchioles, you might have to certainly go in for a bronchoscope, a bronchoscopic retrieval of the foreign body if you want to prevent a pneumonia, an aspiration pneumonia from developing, right?